In this video, we will discover every pertinent medical fact concerning Crohn's illness. Inflammatory bowel disease, which is a class of diseases, includes Crohn's disease. It has the name of Dr. Burrell Crohn, who originally identified the condition in 1632. Chronic digestive tract inflammation brought on by Crohn's disease affects the area from the mouth to the anus. The likelihood that a man or woman may develop Crohn's disease is equal. Although the illness can strike anyone at any age, it is typically discovered in teenagers and adults between the ages of 20 and 30. Even if there is a genetic component linked to an elevated risk of inflammatory bowel illness, family history cannot be used to predict who would develop Crohn's disease. Crohn's disease can affect any area of the digestive system, from the mouth to the anus, but it most frequently affects the ileum and first part of the colon. The entire thickness of the gut wall may be impacted by Crohn's disease. Intestinal inflammation can skip over or leave healthy sections between patches of sick gut. A comparable condition is ulcerative colitis. However, in that case, the colon or large intestine and its lining are the only organs affected by the inflammation. What kind of Crohn's disease are there? Knowing which area of your digestive system is impacted is crucial if you are given a Crohn's disease diagnosis. The site of inflammation determines the kind of Crohn's disease. Ileocolitis, ileitis, gastroduodenal Crohn's disease, jejuno-ileitis, and Crohn's colitis are the most prevalent forms of the condition. The most prevalent type of Crohn's disease is ileocolitis. It affects both the large intestine, also known as the colon, and the terminal ileum at the end of the small intestine. Ileocolitis can cause substantial weight loss, diarrhea, cramps, and pain in the lower right or center of the abdomen. The second kind of Crohn's disease, known as ileitis, only affects the ileum. Ileitis and ileocolitis share the same symptoms. Fistulas are an inflammatory abscess in the right lower quadrant of the abdomen, is possible consequences in severe cases. Gastroduodenal Crohn's disease is another type, which affects the stomach and the beginning of the small intestine, called the duodenum. Symptoms of gastroduodenal Crohn's disease may include nausea, vomiting, loss of appetite, and weight loss. Another type of Crohn's disease known as jejuno-ileitis is characterized by patchy patches of inflammation in the jejunum, which is the top portion of the small intestine. Jejuno-ileitis symptoms might range from mild to severe abdominal pain and cramping after meals, as well as diarrhea. In severe situations or following protracted periods of inflammation, fistulas can develop. Crohn's colitis, the last form of the condition, only affects the colon or large intestine. Crohn's colitis signs and symptoms can include rectal bleeding and diarrhea. This kind of Crohn's is more prevalent than others in terms of skin lesions and joint pain. What are the causes of Crohn's disease? Unfortunately, it is still unclear what causes Crohn's disease. According to recent studies, environmental, genetic, and familial variables all play a role in the development of Crohn's disease. Stress and diet may worsen Crohn's disease, but they do not cause it. Bacteria, viruses, fungi, and other microbes that are foreign invaders are typically attacked and eliminated by a person's immune system. Cells leave the circulation after a typical immune response and go to the intestines. In a typical state, the immune system defends the innocuous bacteria that reside in the gastrointestinal tract. These benign bacteria are misidentified as foreign invaders in persons with Crohn's disease, causing the immune system to begin an attack. The immune response's inflammatory effects do not go away. This eventually results in chronic inflammation, ulceration, thickening of the intestinal wall, and Crohn's disease symptoms. If you or a close relative has Crohn's disease, there is a higher likelihood that other members of your family will also get it. What are the signs and symptoms of Crohn's disease? Since Crohn's disease is a chronic condition, patients are likely to go through flare-ups when symptoms are active and then remissions when symptoms are less noticeable. Constant diarrhea, rectal bleeding, abdominal cramps, the strong desire to clear the bowels, and the impression that the bowel evacuation is incomplete are all common symptoms of Crohn's disease. What are the complications of Crohn's disease? Anal fissure, a tear in the lining of the anus, is the first significant complication of Crohn's disease that can develop in more extreme cases. There may be bleeding and pain from this fissure. A fistula, also known as an irregular channel that develops between one portion of the intestine and the bladder, vagina, or skin, is the second consequence. The third complication is a stricture, which is a narrowing of the intestine because of chronic inflammation. Crohn's disease can cause systemic symptoms outside the gastrointestinal tract, such as mouth sores, swollen and painful joints, skin sores or rashes, red eyes and night sweats. What about Crohn's disease diagnosis? Your first tests will likely include laboratory tests of your blood and stool. Using a contrast chemical, additional testing can involve taking X-rays of the upper and lower gastrointestinal tracts. For a look inside your intestine and digestive system, your doctor can advise an endoscopy. While undergoing a colonoscopy or endoscopy, your doctor may decide to take a biopsy from your colon or another section of your gastrointestinal tract. A small sample of tissue from the interior of the gut is taken during a biopsy for additional testing and analysis. What about the available therapies for Crohn's disease? The use of drugs, clinical trials, dietary and nutritional changes, and occasionally surgical treatments to repair or remove diseased sections of your gastrointestinal system are all possible forms of treatment for Crohn's disease and other irritable bowel illnesses. Medication treating Crohn's disease is designed to suppress your immune system's abnormal inflammatory response that is causing your symptoms. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.